Good evening, everyone. We are here joined by Dr. Kat Gregory tonight to talk about pain and behaviour. We are keeping it a little bit general so that we can talk about pain and behaviour on a general scale, but obviously we are, big focus on parrots. Just to give you a little bit of background, Dr. Kat is a veterinarian. But she is a veterinarian with a specialty in applied behaviour analysis. So she is a veterinary behaviourist. Kat has over 15 years of experience, and she's worked extensively with pets, so companion pets. She's also worked in the zoo industry, aquarium industry. She lectures and provides seminars and workshops here in Australia and overseas. She's worked with all sorts of species, everything from our dogs and our cats to parrots, falcons, marine mammals, gorillas, sharks, the list kind of goes on and on and on. So she's had a pretty amazing career working with lots of fantastic animals. So we are super lucky to have Dr. Kat here with us tonight to have a chat about this. I know this is a topic that, like me, she's pretty passionate about.
Yeah.
Hi, Dr. Kat. Thanks for joining us.
Hi, Lee. Thanks for asking. Actually, this is my not parrot dog called Chobi, who probably needs to go somewhere else.
Is he named after the cheetah?
Yeah. So the big cheetah that I've put video up and photos up of every now and then is a favourite of mine in South Africa. He's one of the biggest cheetahs I've ever met, and this is probably the smallest dog I've ever had in the household. So the Chobi, the big guy, is 67 kilos, which is massive for a cheetah boy, and this little guy's only 11. So it's a funny, it's a tribute to the big Chobi. Chobi is a magnificent big guy, and certainly this one is not magnificent, but he's heaps of fun to train, just like the cheetah boy.
Yep.
So hopefully he'll take after him in some ways, put it that way.
Fingers crossed. In some ways, not always, though, probably. Excellent. So, Dr. Kat, did you want to maybe just give us a little bit of an idea of how you kind of came to be in the behaviour industry and a little bit about your career and get us started on that?
Yep. I originally, like every little girl anyway, you grow up wanting to be a vet, and you tell everybody that, and everyone sort of pats you on the head and says yes, and then finally, blah blah blah. Yes, I got into vet school, went through, and graduated, and was out in various practice spaces for a while. My family lived in Asia for a long time, so part of that was practicing in Singapore. Came home, and then interestingly, one dog came in. I was working in emergency and critical care for a long time as well, and we had one dog come in that I won't forget. It was a bull terrier who was at the end stage of one of the bull terrier boys or girls that spin, and she was had been spinning for days, and the owners were distraught and brought the dog into the emergency facility. And looking at that, I thought it'd be nice to catch an animal who was distressed like that a lot earlier than this. So went off and have done postgrad training in vet behaviour. So I'm trained in behavioural medicine, but I've also sought opportunities to learn from really high quality trainers all over, wherever I can find them, of various species, and learned how to be as good a trainer as I can be as well. Done Susan Friedman's professional course as well, which is my intro to ABA, applied behaviour analysis, and I find that a really effective way of approaching the initial approach to resolving or coming up with plans to help create positive resolutions to animals presenting with behavioural problems. So behaviour is treated, I think, should be treated holistically. It's not outside the clinical space. We can't remove the fact that the animal's got a health status. It has food that it's given that impinge upon its behaviour. It lives in an environment, in a home or with other animals like it or different from it, that also impact its behaviour. And animals that present with problematic behaviour also impact not only their own welfare, but the welfare of the humans around them and other animals too. So I think understanding behaviour helps you to be a better clinical physician as well. And you sort of learning to know what's normal for various species helps you understand when abnormal presents too. So I think my blessing is having worked across a big range of species. I think it's helped make me good or better at what I am, and I'm still learning. That you never really stop. So part of my interest in pain and behaviour started when I was working in critical care. Animals often present with severe acute phase or chronic illnesses that have decompensated, or animals who've been through major trauma of some description, and they present, a lot of them, in a lot of pain. Managing acute severe pain effectively can be life-saving. Lately, there's been a lot more interest in the impact of chronic pain on human welfare, but also animal welfare, and how it's wise to consider addressing that early rather than too late. Chronic pain itself becomes pathological to the animal. The one thing that I think is interesting is that Daniel Mills and his research team at Lincoln University in the UK compiled the stats from a large number of specialist vet behaviourists with animals of various ilk presenting with problematic behaviour. And the outcome of all of those statistics is the vast majority of animals presenting with problematic behaviour also have some pain. So pain could be the reason that they're presenting with problematic behaviour, or the animals could have behavioural problems that are actually made worse by a painful episode. So if an animal presents with a suggestion that pain might be in the background, is absolutely worth considering it as part of the way you approach your behavioural challenges.
Yeah, excellent. Yeah. And I guess just to draw some comparisons, and they're probably not the greatest comparisons, but for those people watching along who maybe aren't sure what a veterinary behaviourist is, it's someone who's specialised in behaviour in the same way that you might have an avian vet who has specialised in avian care. So Dr. Kat has gone and spent a lot of time learning all about the behavioural side, but it means that she can also integrate the behaviour side with the veterinary medicine side, which I think is just so important when we're working with animals, because there are, like Dr. Kat just said, lots and lots of situations where animals presenting with behavioural issues have some sort of underlying physical issue that might be contributing to that also.
And it's interesting to see, once we address an animal's pain really effectively, how some of the behavioural challenges actually just melt away.
Yeah.
So and I guess the other thing that we probably should mention is that we have been working together collaboratively to help one of your birds too, Lee. So
That's
did you want to tell the audience about his background a little bit?
Yeah, so some people that do follow our Facebook page and our Facebook group would be familiar with Aztec, my blue and gold macaw. So I got Aztec joined me about just over 3 years ago now as quite a little fluffy ball of feathers after his parents rejected him and stopped feeding him in the nest. So he was about 6 weeks old at the time, and he needed somewhere to go. So I took him on and I finished hand rearing him. Just a quick note on that, it's not something we recommend doing. I would never have taken on a bird that required hand rearing if it wasn't for the fact that he had been rejected by his parents. So I hand reared him, and he, was overall pretty good, and grew up, fledged. Went out into an aviary with my green-wing macaw. They weren't the best of friends, but they were happy enough with each other. And then at around 9 to 10 months of age, he started damaging his primary wing feathers. Initially, I just thought it was probably baby breaking feathers, but it became clear relatively quickly that actually he was chewing on these feathers and they were getting broken, and it started with one wing, progressed to another wing, until he was actually completely non-flighted. So he had 0 primary flight feathers, he was chewing secondary feathers, and it got quite bad. And that kind of triggered off a series of vet visits where I would take him into a variety to his avian vets, and we went through x-rays and CT scans and all of the testing and bits and pieces, and we weren't really having any luck finding a reason for his behavior. or finding any luck getting any kind of resolution with it. So that's when I kind of reached out to Dr. Kat and went, hey, I need a different perspective on this. I need somebody with, as Dr. Susan Friedman would say, I need someone, with that different lens to look at this particular situation. And so that's when I brought Dr. Kat in. And so we've been working together. It'd be about 12 months now with Aztec on trying to find the right medications and to work through his further destructive behaviour.
And I didn't think, when I heard about him and looked at what he was doing and looked at that history, I didn't really think it was just a behavioural challenge. I think he's a lucky bird in the sense that he lives with somebody who understands his behavioural needs as a very young growing parrot and has good training skills. His life was very enriched. He was in a very good social setting with humans and other birds. So I was thinking maybe there may be something to do, not rather than just a simple behavioural problem, maybe some of this odd behaviour. And the feather destructive behaviour was a little different to normal, because mostly with behavioural problems with birds who are destroying feathers, they're going for areas along their chests where they can reach easily. So attacking his primary and secondaries was a bit unusual. So we gave him a pain med trial to start, and he'd been on a non-steroidal for a little while.
He'd been on, meloxicam and tramadol as well. Yes, yeah, and then we obviously started to look at other options.
So we added in a different medication, one of the two gabapentinoid drugs, and we worked out that we decided to use pregabalin at that point, and he improved. So that was an interesting sign. Gabapentinoids will calm the central and peripheral nervous system, and I was looking at the possibility of neuropathic pain maybe driving what was going on. And it is a drug that helps to address neuropathic pain really effectively. So that improvement was suggestive that maybe he has background chronic pain. So our approach medically with this little boy has been, on my part, providing medications at a balance that keeps him comfortable to allow him to regrow primary and secondary feathers gradually. And we're getting somewhere. It's just we've got to be patient because he's lost all the support of his other primary feathers. Normally birds won't molt all feathers at once. So it's a delicate journey when those primaries start to grow in. So he's improving. I don't think we've got him normal, and I think it will be probably a couple of years to get something to where we hopefully will end up with a bird who's able to fly again.
Yeah, and I think that's one of the other challenges in this particular situation is, as you said, he's lost all of that support of those feathers, but also because he is completely non-flighted, probably one of the challenges that we have is that he unfortunately is also incredibly silly, and he likes to hang off things and flap upside down and throw himself around, and he has falls, and I think that those probably trigger episodes of pain that are worse. And yes, yeah. So I've definitely seen him allow his feathers to grow more, and to a greater extent than prior to the current pain trial that we have him on. So it's just constant work in progress. So
and it's not just drugs that he's being treated with. I think the challenge with him, he's a young, almost primate-like little creature who's challenging cognitively to keep entertained. So Lee's continues to do lots of enrichment, lots of training, and also lots of cognitive challenging stuff for him as well. I think it's been absolutely critical. So it's about trying to sort of set the stage with medication, but then we've got to keep him happy and engaged with life otherwise, so he doesn't think about focusing on those precious feathers again so much too.
Yeah, absolutely.
So it can't be one in isolation, not meds in isolation.
Yeah, that's right. And I mean, I know in humans that, this is probably a little bit of a rabbit hole off to the side here, but, having people that I know quite well who have dealt with their own chronic health issues, that cognitive side of it where, they might be on pain medications But those pain medications over time, the more you take it, the less effective they can be sometimes. And then what they've found to be the most effective sometimes for treating their pain is being able to sink themselves into some kind of activity that takes up all of their brain power. And they've said to me that they've been able to drop how much pain medication they're taking because they have this other activity that's keeping so much of their brain occupied. So absolutely, and that's why that other side of the cognitive training is really important as well.
And cognitively, chronic pain actually creates cognitive changes as well. So the pain itself, chronic pain, can take so much brain focus that cognitive skill sets start to drop off. So it can be associated with cognitive decline because all of the attention is on the pain. So if we can give an animal more enriching range of things to keep that brain happily occupied, the focus on those the irrits from the feathers will be allowed to dissipate as well. So it's about treating the whole animal, not just the brain itself. We've got to make sure that he's got a happy cognitive bias as well, so that he gets better and allows himself to get better and heal as well.
Yes. Yeah. So that's how we got, I guess, a little bit more involved. I was well aware of Dr. Kat for a number of years, which is why I reached out to her. So we're really lucky to, I think, probably for me, I feel really lucky that we have somebody that has that background, who has worked with lots of different species as well, because that's really important. So working with a bird, I imagine, is relatively different to working with a dog when you're treating.
I think when I was wanting to learn from other trainers, I think what I realised, certainly at one of the major zoos that I had a lot to do with for a while, what I realised was that good bird trainers could be deployed in other sections pretty effectively, but it doesn't always go back the other way. I think being a good bird trainer is about being very aware of the nuances of body language really well. So I think good bird trainers read body language really well, and I think that's really critical to know how an animal's feeling during your training as well. And it requires, and you can't make a bird do anything. It doesn't want to. So you have to work positively. There's no way other than that to work with a bird, in my opinion. So I think it teaches a good general approach with a strongly positive bias in the way you shape behaviour. You cannot, birds won't tolerate being forced to do anything, unlike these guys who are very tolerant and will put up with a lot of bad things from people sometimes. Horses also will put up with a lot of bad communication coming from humans. But a bird, certainly a bird who's flighted, if you upset a parrot, if it's flighted, you will lose it. See you later. Yeah. I don't want to interact with people I don't like. So
you'll lose it or you'll lose your finger. One or the other.
Yeah. So and I've worked a lot with raptors as well. So they're a different sort of bird in the sense that they're not like a parrot, a social being in general anyway. And so it's a little slightly different approach, but it's still got to be positive from the bird's perspective. Again, once they're up in the air and you've got them flying, they've got to want to work with you. And how else are you going to create that desire to work with you except in a positive way, I think. So each of the styles of birds teaches you differently, and within each group of birds there are variations on the theme as well. Yeah. So the more you know, the more you need to know. I think they're really interesting.
Yeah. Switching from dogs to birds was, I think it definitely just like the amount of learning that I went through in that period of going from working primarily with dogs to starting to work with parrots was huge. Like, I found it really beneficial. So I think it definitely improved my knowledge and my skills and my observation skills especially. Yeah.
So have we got any questions anywhere, Lee? Is everyone just enjoying us bantering around the whole story?
Just chatting. I did actually want to, before we do have a question from Donna, which we'll get to. Donna's here tonight, and she did send this through at last week. But before we did touch on that, I did actually want to, I guess, just get you to give people a bit of a rundown on why vetting for and checking for these issues, so pain or illness, is so important when it comes to dealing with behaviour problems with our birds.
Well, I think that Daniel Mills' recent publication that I alluded to earlier highlighted the fact that any change in behaviour from the norm for that particular individual needs to be taken seriously. But a change in behaviour doesn't mean the animal has a primary behavioural problem. So before I see anyone with their animal for a behavioural problem, I send them to their vet for as thorough as possible clinical examination to at least rule out basic stories. I want to make sure the animal's healthy and doesn't have any background pain or background underlying clinical illness, because I'm not going to get improvement if the animal actually has some red flag that I haven't properly addressed yet. So that's where good collaborations between different professionals is really critical. For example, apart from, I certainly see dogs. I was recently presented with a young English setter puppy who is deaf. We knew that, but he also seemed to have some vision issues. So I sent him, before I saw him, I wasn't sure, so I sent him off to an ophthalmologist to actually assess his eyes correctly, and he actually has bilateral retinal dysplasia as well. So that doesn't mean I can't help him behaviourally, but knowing that he has two senses that are compromised is very helpful. He also, now I know him better, has some proprioceptive issues. I think he's got a cerebellar issue, so he's got lots of challenges. So if we understand the pathologies, we can actually help his behavioural outcomes a whole lot more effectively. So It's not one person has all the answers to every problem. And I think being gymnastic about how you approach behavioural challenges is really critical to do it right. We're not going to get the health of the animal or the pain status of the animal too.
Yeah, I think, like you said, that that's the real big part, is that, no amount of behaviour modification exercises or training is going to help if the animal is suffering from something else. You might see some small improvement, but you're not going to see good resolution if you're struggling through, if your bird's struggling with some kind of pain issue.
Correct. And if you've got a good trainer who does a lot of behaviour consulting, who I know has a reasonable approach for behaviour modification, and they've got a reasonable plan and they've had no progress, that's also a red flag to reconsider, does the animal have something pathological going on, inclusive of pain, in the approach. So don't persist if your plan isn't working as you might expect it in a normal story. Then if not, then you thought initially it was a behavioural problem, you've run with a good plan and there's been no change, or the animal's got worse, then send them back to the vet as well, or at least dialogue with the vet, because it's worthwhile. Sometimes we can miss subtle changes early on as well.
Yeah, and I guess that's the other thing with birds as well, is that, the one thing that you hear kind of often repeated about birds is that they hide illness and they hide pain really well. But I think actually it's probably that, I don't think they hide it as well as we think it is. We just sometimes write off what is the signs of pain or the signs of illness in them as behaviour problems. It's just hormones. Probably my least favorite phrase ever, because it really does, like, every time I see someone post, oh, my bird has started doing this, or my bird has started doing that, almost always there's an overwhelming number of comments that just say hormones, or it's hormones, you just have to put up with it. And I'm sitting there going, but what if it's not? Like, one, it's just like, hormones just makes it all internalized, and as we know, that's not how behavior works. But on the flip side of that is also, maybe the bird is sick. Maybe the bird is sore. And because people are just getting this constant narrative of your bird is just hormonal and hormones are just going to happen, how many birds are missing out, and going through life with these behavior problems that we're just putting down to hormones, and really they're dealing with some kind of chronic health issue
in some way. Yeah, I agree. And I guess the other thing that's important to remember, if an animal's in pain, it's emotionally challenging for that animal. So a bird is running around with some level of chronic pain nagging constantly at him. His emotional cup is quite full already. So it doesn't take much to push his buttons and have his emotional cup overflow and for him to behave in a strange, out of context way. So another red flag to pain maybe being a driver is a sudden change in behavior as well. One example in a dog space is a dog that I've been treating for a while for a behavioural challenge. She was doing really well and we'd started to gently wean her medication off. Owner got in touch with me and she said, she just bit me. And I thought, that's really odd. And I said, so what happened? Can you describe what happened? And she said, I just reached out to touch her head and she bit me on the hand. And I said, she's been so good. I don't think it's her behavior that's the reason. Maybe take her straight to your vet. Anyway, that day she did go to the vet for an exam and she had unilateral otitis as well. So she had ear pain. So she was being defensive. And now once that was treated effectively, that sort of issue's gone away. So she wasn't, again, aggressive. She was being defensive about an area of her body that was causing her quite a bit of angst. She had been not scratching at her ear, not indicating that it was a problem, but it required a proper examination to rule that out or in, and it was clearly diagnosed initially, straight up. So always a change in behaviour is suggestive of maybe pain being part of it as well.
Yeah, as you said.
Especially with aggression.
I'm going to get angry if people are, trying to like touch me or handle me and I'm sore. That's, absolutely, I'm probably going to get angry, especially if I don't have any other means of communicating. As a human, I can say, please don't touch me, I hurt. But as an animal, a dog or a cat or a parrot, they just don't have the ability to say it, or they are saying it, but we're missing out on those big kind of body language cues that they're giving to us.
So sometimes if you're not sure, what is worthwhile is considering a pain med trial. Sometimes, certainly with chronic pain, where the clinical signs across all species are actually quite subtle in presentation. So one example, I suppose, a recent example was an older tiger that was part of a discussion with the veterinary team not very long ago. This cat was 19 years old, so she's quite old, and was spending most of her day just pacing around in her enclosure, spending so much time pacing around her enclosure that she wasn't eating very well and just didn't look happy. And yet I'd looked at all of the work the training team does and the keeper team does around the property. They do well. They have good training protocols. They have excellent enrichment programs. So I said, maybe she's uncomfortable. Maybe she's pacing around because she can't get herself into a position where she can relax and rest. So rather than just focusing on a cat with what looked like a stereotypic behavioural problem, we gave her a pain med trial. And within about 10 days, they have CCTV on this animal all the time, which is really helpful. Within 10 days, that pacing behaviour had dropped off by 60%, massive. So I said, well, we're on the right track. And so after that, we also created a more comprehensive pain medication program, and she's maintaining pretty well on a combination of meds over time now. So we're not we haven't got to the bottom of what the pain or where the pain is necessarily located for her, but we can say that her well-being has improved significantly to the fact that she's a much happier cat now.
Yeah,
so
absolutely.
How do you run a pain med trial? I always like to keep it simple early. So usually choose a standard dose of a non-steroidal anti-inflammatory drug and another drug, ideally, that would address neuropathic pain. run with that for around 10 days or so, 10 to 14 days. During that time, if you're on the right track, there should be some improvement in the animal's behaviour. And given that, you reassess the animal and you can create a more comprehensive program moving forward to address the whole story better again for the animal. And there's a lot we can do for pain, chronic pain these days as well as we move forward.
Yeah, absolutely. There's so many options now that we have, and I think that's something that I guess I see semi-regularly is maybe some reluctance from people to put their birds on some medications because they've heard that, you know, this is bad or that is bad. So I guess, you know, is there anything that you can say to help people feel, I guess, a bit more comfortable with that? I know that, you know, some medications get a bit of a bad rap sometimes. So
like what? Like the non-steroidal anti-inflammatory drugs, for example?
Yeah, I do remember that one coming up semi-recently. I can't remember exactly what it was that the person had said, but I kind of debunked it. I can't remember what the concern was. But yes, certainly meloxicam and those non-steroidal anti-inflammatories, I think, are in there. Yeah.
Yep. So what we need is that we need to know, ideally, before we start, the clinical status of the animal to make sure it's in a space where the animal's well hydrated as well, which is really important. And I tend to I wouldn't use a loading dose usually of meloxicam. I just start them on a maintenance type dose and keep it as low as possible. And then any of the drugs that address neuropathic pain tend to be quite well tolerated across the board clinically by animals. I think our challenge with AWST has been that some of the drugs, or two of the drugs we've used, haven't been used. There's not a lot of data on them in the literature. He's on 2 different drugs to help with neuropathic pain management. So he's on pregabalin and also memantine, which is an NMDH receptor antagonist. And the only data I could find on that particular class of drug was something that was published where a peregrine falcon with a fracture was treated with intermittent injections of ketamine, which is another relative of memantine. That bird was released, so I presume went just fine. And anecdotally, we've got lots of data in the mammalian world on these drugs, but less so in the avian world. So I'm always, I'm pretty cautious by nature, try and get data from other colleagues. If I don't have it, if we're going to trial these meds, we start doses at a low space and keep an eye on the animal itself and listen. I listen very much to those people around the animal immediately. So if we have any off-kilter behavior, we'll drop back to a lower dose and then maybe drive it up. So it's what I would say is what we've got with him at the moment is trying to address pain in multiple ways. And the one positive of a polypharmacy type approach is that we often end up using lower doses of all the drugs to better effect as well. So each drug has its place, and we don't necessarily have to keep using the non-steroidal, but it is a nice way of assessing if pain is in the background of why the animal's presenting with problematic behaviour in the first place. So I think we've been challenged by this little guy, but I think we've learned a lot in the process.
We certainly have, but yeah, hopefully at least we've taken away some good stuff as well to help other birds. But I think it's also, I guess, important to add that, you know, if you're using pain meds, I guess sometimes people worry that they're going to cause some kind of sedation, and I don't think you should really be getting that if you're on the correct dose for the bird. And I think sometimes people confuse the bird or the animal finally feeling good enough to actually get a decent amount of sleep as well with being
critical.
Sedated or lethargic. It's, you know, sometimes people go, oh, my bird was really lethargic on that, and it might be because they were just so in so much pain that they weren't getting quality rest, and when they were finally out of pain, they started sleeping and catching up on all of that sleep that they'd missed out on as well. So I think that's something to keep in mind. These sort of things need to be, I guess, that's the, you know, something that I like to stress is you can't just slap things around and do them for a week. Well, you know, a couple of days go, oh, this isn't working, and then quit and try something else, because often we need at least a little bit more time than that to really be sure that this is either not working or it is working.
And if neuropathic neurons have been little neuropathic neurons. If little pain neurons have been firing for a while, it does take time for them to calm down and settle down and start to take the animal away from the chronic pain loops to different loops. So it does take time for quietening down. I did see a dog today who little cocker spaniel that had otitis, which was, I think, driving some of the problematic behavior that the owners presented him for today. And he responded beautifully to 5 days of gabapentin, but that's now stopped. And I thought, well, if I think he deserves to be on a little bit longer course of that pain medication, considering he had an out of sight positive response to it. Let's keep him on it for a little bit longer, and then we'll gently withdraw the medication as well. So it does pay to keep them on 3 to 4 weeks of good quality analgesia as well. Yeah. And certainly 3 to 4 weeks or longer of something like pregabalin is very safe. We try to keep the exposure to non-steroidals to as low a dose as we can have and for as short a time as we can have, but it's got to be long enough so that we see the animal improve clinically. Yeah. So we're looking for a happier bird. So with Aztec, I think one of the nice early signs of him responding nicely, for example, to pregabalin is that he allowed you to help him when he needed some trimming of broken feathers.
Yeah. And that's, I guess, one of the things that, like, when I contacted you, I was still in my head, like, even though the vets had gone, like, we've done CT scans and we've done this and we can't see anything physically with exception of, like, this really minor bone issue that shouldn't really be causing this level of, like, issues. When I contacted you, I was still in my head, and, I know I said it to you, I was like, this, I know this bird and I live with him all day, and it feels like pain to me. It looks like pain to me. And one of the things that was a big kind of, yes, it probably is pain, was when we got him onto those medications and suddenly he softened up and he went from being, screaming and biting if I tried to handle his wings to being happy for me to lift his wings up and manipulate them and sometimes trim back, bits of broken feather and stuff. It was just such a massive difference, but he wasn't sedated or lethargic or just letting me handle him because he was on medication. He was still lively, and he's always lively and happy. So
yeah, I think pain medication or behavioural medication are a nice balance for the individual. The only people who will know the animal's on medication are you, me, and the animal, because we're aiming at normal. We're not aiming at flat, sedated animal. And I will say the meds he's on aren't going to sedate him anyway. One of the meds he was originally on, tramadol, could sedate some birds at a too high a dose, but he's not on that anymore at this point anyway. Tramadol is an interesting drug. It can help cats with pain, but it isn't very helpful for dogs. And so whether it helps birds, I don't know whether the jury's still out on it as well. It's an interesting kind of medication. It may have its place, so I think it was reasonable to consider it as part of what we were doing, definitely.
Yeah, and just like, having vets that are willing to do pain med trials and stuff is fantastic in the first place as well. So to go, let's try him on some tramadol and some meloxicam and see if we see any improvement. So I guess the hardest part of his particular behavior is that there's long gaps in there where we just can't really get much in the way of any kind of data, because if he's got no flight feathers, we're kind of in a holding pattern, and we've got to wait until they start to grow back before we can start to gather that data again. And it doesn't, it's a bit of a strange, and for anybody out there listening, he doesn't touch another feather on his body. It's literally just his wing feathers. He doesn't touch his body feathers or his back or his vent or his neck. Every other part of his body is in perfect condition. It's only his flight feathers that he chews on. So it's a very different kind of presentation to what you would, like Kat said earlier, see in a bird who is experiencing maybe some stress or some kind of behavioural plucking disorder.
And it's not like he's not stressed because he's not stressed because he's painful, and that's causing the distress in this little guy, I think. So I guess that's where, I guess one thing I can say, I had a recent presentation of another macaw just by happen chance, and also blue and gold by happen chance as well, who had acutely mauled his primary and secondary feathers on both wings. And so I thought, okay. So we went hard at him with the same sort of balance of medication that your little guy was on, and he is much improved. So I guess his advantage is we got into him comprehensively really quickly, and I think that's going to save a lot of suffering with this particular bird. I still to this day can't pick why he did that, but he's a lot happier and is allowing his primaries and secondaries to grow back in right now. So hopefully he keeps tracking in that direction. Yeah.
Yeah, and that's great. I mean, yeah, you know, from my perspective, I'm like, well, you know, at least what we're going through is helping other birds. So, cool.
He's got the same flavoured medication too. I've got compounded is the same flavour. It seems to be yummy. Yeah.
Yeah, Aztec certainly doesn't mind it, which makes my life really easy because, you know, at one stage he was there, he was on it, you know, he's on it 3 times a day. So,
well, and I guess also, Lee, it might be worth saying that some people would worry, how are we getting medication into him on a regular basis? We've compounded the meds that I've prescribed such that they taste really nice, and they're in a liquid form as well. And he, as far as I know, he thinks it's yummy and a treat, really, because he's medicated several times a day as well.
Yeah. Aztec gets excited when he sees me pulling the syringes and stuff out. He thinks it's treat time. So, it's worked really well.
So what were the questions that we had? Do we have?
Yeah. Okay. So we've got questions, and I'm just going to bring up some photos that one person has sent as well. So let me just share that screen.
Will I be able to see them on here?
Yeah. Yep. 2 seconds. You should be able to see it coming up any moment now. There's a little bit of a kind of delay there. So, so the question is from Donna. She said, this is her bird, Rosie. She has always been anxious and nervous, so much so that she is barbering all of her feathers. She has a friend, enjoys showers, has lots of interactive toys and foraging as well as loads of attention from her, Donna. She eats a wide variety of veg, fruit, nuts and seed, and is free flighted. So I think she just is flighted, so she can fly around. But she can't fly at the moment because her feathers aren't in good condition. She's been giving her chamomile tea to help calm her, but she wants to know if this seems like a sign of something more sinister. Her other Alexandrian is completely fine. And I know that she did mention earlier in the comments that she has a veterinary visit booked, but she said no avian vet close by. So, and she didn't want to stress her out with a really big drive to get her to the avian vet. So she's booked her into a local vet. So I guess, you know, any thoughts, I guess, on maybe we can give her some thoughts on what, you know, Donna can speak to her veterinarian about looking at here for Rosie.
Yeah, I guess what you could do, of course, is that her primary care vet could liaise with avian vet to help as well, because we do talk to our professional colleagues as well. And if you're situated remotely, what the primary care vet could do is do some basic stuff and then liaise with a bird vet who's more experienced in avian medicine as well to know what to rule in or out. So there are some viruses that might be impacting feather quality in some birds. I think also, is that the same little bird?
That is, and something that I noted on here, and Donna, if you're online and can pop any answer, like, you know, if you want to make any comments as we chat into the comment box, that would be super helpful. I'm noticing on this photo some dents in the beak there, and I don't know, Donna, could you tell us if that's from some kind of injury? But it just stood out to me because the dents in the beak might indicate something else going on.
Like nutritional issues, you think, or?
Yeah, possibly. And I guess the thing I noted was that in Donna's question, she mentioned veg, fruit, nuts and seed, but not pellets. And unfortunately, if I know there's a big push towards all natural diets for birds and pellets are bad. Her friend bit her a couple of times. Yep. Okay, cool. I do think that pellets are important because often birds will pick and choose the foods that they want to eat. And we did kind of, and so nutritionally pellets are, every time they take a bite of a pellet, they're getting a balanced bite of food that includes all of the very important vitamins, minerals, and nutrients that they require. And when they're not getting that, it can have big effects on their overall health. So, and they often will, things like seed and fruits and nuts and that can be deficient in things that they really, really need.
Birds don't really, in the wild anyway, they're constantly moving from one area to the other. So it's really hard to know exactly what birds need nutritionally. The problem also, birds behave like little toddlers, and if you give them a choice, they'll always choose the jelly beans over the broccoli consistently. And the advantage of pellets is that all the foods that we hope that they require are packed into one thing, and so they can't avoid that option. How do you present? I mean, it's a challenge in and of itself, but I love having fresh food available to them all the time. But I think that a background of a quality pelleted diet is really critical to make sure that we're covering all bases, ideally. So that would be part of what should be done. And Lee could probably talk to you about some of the higher quality options that we have available here in Australia.
Donna did ask a recommended brand. Look, VetaFarm is a good quality brand. It's available all over Australia pretty easily in most pet stores. So VetaFarm's a really good option. Same, Andy Kendo said, what pellets for macaws? Again, VetaFarm macaw nuts are a good option, or the South American pellets, because they're the same, just a different size. I did do a pellets/nutrition live stream about a month ago with a chemist, a PhD chemist, and she broke down some of the common myths and stuff around feeding pellets and that. So definitely go and check that out as well. It's just called The Great Pellet Debate with Stephanie Rosenblum, and that was really, really handy. But VetaFarm, I think is a really good option here in Australia. So definitely go and that's something I would definitely add. I don't necessarily think that, and she did say that her other Alexandrine had bitten the bird on the beak, which is the injuries on the beak. Poor little fella. But I don't necessarily think that, I'm not saying that adding pellets is going to be a magic fix for what's going on. But certainly, like Dr. Kat was talking about earlier, it's a very much a holistic situation, and you want to make sure that you're addressing all areas, and nutrition and diet are way more critical than people realize. So
especially for birds or other exotics in human managed care, I will say as well. So we still, I think it's basically making sure that the animal has what is as close as possible to what we think is a balanced diet for that particular species. And if that's the case, is he eating really well? That's a question.
So Donna, does Rosie eat? Does Rosie eat quite well? So she's got a good appetite. Is that what you're kind of asking, Kat? That she's a good eater? She's eating fine.
Okay. So you want to rule out mites and other things like that, and then look at her environment where she's living as well. And that's where someone like Lee and her colleagues can help you with all of the basic environmental needs and nutrition of a parrot. And then the vet can rule out viruses, for example, that might be causing some of these feather changes, and toxins as well. And if there's any yeast or bacteria causing that sort of problem as well, or at least driving it. But you want to make sure that you've ruled all of that out, and then you could start to consider whether this might be, if the history suggests, if there's a behavioural problem, or is there some issue with those feathers coming through. That might, part of the focus on those feathers might be that there's background chronic pain. There is a lot of crossover. If we're looking at psychopharmacology, a lot of those drugs help animals with behavioural challenges emotionally, but they also have some aspects of helping animals with chronic pain. Both on the same drug can help on both sides. So if I have a consideration that the animal might have chronic pain, I can choose medications to help address what's going on and also address some level of chronic pain too.
Yeah.
That's more likely I think more likely going to be chronic something going on, maybe not just pain though.
Yeah. Donna said the birds need to be wormed. It's not the same as dogs and cats. The best person to talk to is generally, it's going to depend on a number of factors. And so avian vets are definitely the best people to talk to about that, because they can take into consideration your bird and their lifestyle and things like that as to what sort of worming they require. So generally you don't treat birds in the same way you would treat dogs on a particular schedule or something like that. So they can be wormed. But you should definitely talk to your avian vet ideally about what is the best option for your bird.
There's an avian vet website too for all the Australian avian vets that they can then try and find a locale, and they will be contactable as well. A lot of them,
Donna, out of interest,
can't be everywhere. Yep.
If you don't mind saying kind of your general area, because there are also vets that who might not be avian vets, but have a really good understanding of avians and are really interested in them. But as Dr. Kat said, also, I found in the past, I used to live regionally, very regionally, remotely, in fact, in Port Hedland. And when I had to have my ECI treated, my GP local vets just worked closely with the unusual pet vets, and we had discussions between the three of us, and that was worked really well, and they were all happy to do that. So okay, so some more information. Donna has said that it happened literally overnight from March the 20th. She's always been nervous or anxious, but this seemed to be very sudden. So that might be an indicator that it could be an indicator that something's happened that's tipped her over the edge, so to speak, but that could be a health issue as well. So definitely something you want to rule out.
First rule out that, and then focus on what's left as well behaviorally. Also video. The other thing that I like from my clients, whatever animal I'm seeing behaviorally, is I like some little snapshots of their daily life as well. You can see a lot in actual short little videos, and it's very easy to share that as well. There's some subtle things you can pick up that might indicate the animal's uncomfortable for whatever reason. Yes, so pain might be part of it, and we might pick up some odd little behaviors that might give us a clue about what's going on. And also it provides baseline data. So if we do start a behavioral management plan, or we start a medication plan, you can look back later and see. Often improvements take a while. Behavior and chronic pain are slow journeys to recovery. So sometimes improvement is apparent, but we don't always perceive it because it's subtle as we journey forward. But if we can look back at where we started, we can see bigger changes that way much more easily.
Yeah, and with a bird like Rosie, who, because of the damage that she's doing, where she's chewing at the feather and damaging it but not pulling it out, it can actually be very hard to see improvements, because you're not going to see those improvements until she starts to molt and regrow new feathers. And so having, other data that you can utilize to track to track whether we're seeing improvements in her general overall demeanor can be important as well, because it's something that might take you 6 months or more to see any kind of improvement in her feather quality. Donna, because you're in Queensland, I am a massive fan of the unusual pet vets. There's a clinic on the Sunshine Coast, so if you get your local vet to liaise with them, I'm 100% sure, having worked very closely with them myself, that they will be more than happy to help. So chamomile tea, it's not going to do any harm. It's one of those ones where I wouldn't rely on it, and I'm always really cautious about people who want to try supplements, because sometimes what happens is it delays other care that should be happening. Yes, so
there is some data on green tea for being calming as well. So, but I think it's something that's an adjunct part of what we could do. So an additional story that we could do. But I would say that presenting this little bird to somebody to look at clinically would be wise sooner rather than later, because you don't want to end up with, once you've got lots of feather follicle damage, there is no coming back. So looking at that looks like big trouble coming already. And I think I'd make sure that we get to a clinic for a clinical examination sooner rather than later. It would be wise. And the unusual pet vets have branches all over Oz now, I've noticed.
Yes. Yep. Yeah. Dr. James and his team do a fantastic job. And as I said, the team on the Sunshine Coast are Aztecs and my bird's primary vets, and like I've always found them to be very incredible. So, cool. So you're on the right track. You're getting into a vet tomorrow. That's fantastic. Hopefully, just ruling out that side of things, and then, as Kat said, I think, the next step from there, if you don't find that there's anything particularly on the tests that are standing out, then I'd strongly recommend you reach out to somebody for a behaviour consultation, because the sooner you get on top of feather destructive behaviour, the sooner you get on top of any problem behaviour, the better, but feather destructive behaviour I find is particularly critical. The longer it goes on, the harder it gets to resolve, and it can become like a real long-term problem.
Won't get better on its own, generally speaking, I don't think.
Yeah. Cool. We had another similar question. I'm going to pop that up on the screen and just read it out as well. So Leslie said, my blue and gold has been put on Prozac due to plucking. It is difficult to get her to take it. She doesn't eat like she used to anymore, and she acts like she doesn't trust us now because we tried different ways of administering the medication. Can pain be a cause of plucking?
Yes, but also the other thing that you need to say to your vet is that you're having trouble giving the medication. Because I work a lot with one particular compounding pharmacist, and they can present the medication to the animal in a variety of different ways. And so we can manipulate flavor. Prozac, the drug is actually fluoxetine, is quite bitter. So a lot of animals don't like bitter tasting things. And so if I was trying to medicate certainly any birds, ideally something should be presented to them looking like it's sweet, and then they're much more likely to be good, compliant little patients as well. So I would definitely red flag it. If you want to give the medication, it's got to be given every single day, and if you're having trouble, then let your vet know, and they can liaise hopefully with a compounding pharmacist to help you, because there's lots of things compounding pharmacists can do to improve compliance in patients. Compliance means that you'll take the medication readily.
And without further information, it's hard to say. But some of the things that you can look at, or your vet can look at, is even patterns of plucking can give quite a lot of information. So plucking where it's very localized or on one side of the body can sometimes indicate pain or illness, whereas often behavioral stuff will be more kind of similar on both sides of the body. So it's, certainly things to look at. And I guess it would depend on what sort of testing and things have been run so far.
And gout is one of those things that can cause pain in parts of the body. So that can't be ruled out without doing some blood testing as well. So, and certainly if it's on one side rather than the other, then that's a red flag as well. Is there a history of trauma? Is there a history of something that might does the bird have arthritis? Older birds can have arthritis, like older mammals can have arthritis as well. And that is one of the biggest causes of chronic pain in animals and humans across the board as well. So definitely worth looking at earlier. One other anecdotal story, one of the little birds in the show in Auckland is an ex-pet and came with problematic feathers already. Every time she's molting, she's put on some anti-inflammatory medication to stop her from redoing that sort of behavior. I think she gets genuinely uncomfortable when she's molting. So during the time of molt, she's on non-steroidals, and that stopped her repeating the feather destructive behavior. So that is indicative of the fact that probably for that bird, it's been chronic pain that's driven that original behavior, I'm pretty sure. But it's nice that vets are thinking about it. Certainly at Auckland Zoo, they are thinking about it.
Yeah, that's excellent. You know, and I think in cases as well as I guess there's just those, yeah, triggers that bring old habits back up. So yeah, like I said, they might go through most of the year all good, and then that molting cycle just
It's a
happens
stressful
to,
time for birds anyway, and so
yeah,
if that is associated with changes in their behavior, then maybe they're genuinely uncomfortable. They're more uncomfortable during that time. It is an uncomfortable time for many birds, molting. So I think that story where they've put that little bird on some non-steroidals, and they probably had, now they've had a bit of exposure to pregab, they might use one of the gabapentinoid drugs during that time as well. That might keep that little bird more comfortable, so she doesn't start doing the original reason she was given to them as a pet many years ago.
yeah, as tends to happen. Yeah. Okay, cool. Yeah, so plucking absolutely can be pain related, and would definitely recommend, I guess, if your bird is on Prozac, it obviously means that they have been to a veterinarian. So keep working with that veterinarian. But, if you know your bird best as well, and I guess, are there things that indicate to you that maybe your bird is uncomfortable in other ways? And if that's the case, then go back to your vet and talk to them about it. And, this is your bird, and it's certainly up to us to be advocates for them because they can't do it for themselves. So.
And don't just say, we tried this medication and it didn't work, so medication doesn't work. Like, what medication? What dose of medication? How long did we use that medication for? All of those important questions need to be reviewed. And so I think if you're not getting an improvement in the bird's demeanor, then make sure you go back to the vet and discuss it with them as well. So the journey of the approach to pathology is to make a plan, run with it, but then review. And if you're not getting improvement, then changing tack with your original clinical thoughts as well. So vets won't dismiss you. They'll say, okay, so let's try something else potentially to improve things. You're behaving like a 2-year-old child tonight. Sorry. It's usually really good. I haven't had that chance not to. You're just being so naughty. Anyway, at least he's not a parrot. You're a bit naughty tonight. I don't know. So I do live with animals, just like lots of us. So are there any other little questions that people have burning in their little minds?
So this one's not related to pain, but related back to the worming question. It was about frequency of worming for birds. Again, yeah, I would definitely talk to your avian vet about that more than anything, because they don't necessarily need to be on it on the same kind of frequency as dogs and cats. Ooh. Have you experienced any health issues or behavior issues with using nuts every day as reinforcement? Yes, but it depends. If you're talking, you're giving your bird 30 walnuts a day, then absolutely you're going to have health and behavioral issues.
Because you'll have a very fat bird, I'd imagine, as well.
So it's going to depend on how many you're giving. Nuts, especially for macaws, and I know that Andy has a macaw, are actually a really important part of their diet. They have a higher requirement for fat than some other species, and so nuts are a really important part of that, and getting that fat content as well as the other good things that are contained in nuts. But it's everything in moderation. If you're feeding so many nuts that your bird isn't consuming other foods, then that's a problem. So.
And do you encourage regular weighing of your bird as well, Lee? Because I always ask that, why? Because if I'm going to medicate a bird, I need to know its exact body weight so I can give it a correct dose as well. So it's always critical. It's also one of the things that goes off when the bird starts getting unwell. Unless you know what the normal body weight is for your individual bird, you won't know that that's changed. So weighing, how often would you weigh, Willie?
I try and do it every week, but sometimes it'd be more often than that. So, because like even the amount, especially if you've got a sick bird, the amount that the weight can change just in 2 or 3 days is actually quite substantial. So at least once a week, but more often if I have a concern as well. So if I'm seeing something else that might be concerning for me, then I'll generally weigh them every couple of days then.
If a bird's dehydrated too, their weight will drop too. So if you've got a bird that's actually dehydrated, its apparent body weight will drop, and it won't be about body mass. It's about volume. It's about the fluid in the poor bird as well. So everybody clinically always I'll ask, well, what does he weigh? When anybody's asking me a question about their bird's health, I need to know if we're going to actually start them on whatever, antibiotics or psychopharmacology, we need to know those things. So baseline body weights, and I guess that's a good thing to teach a bird, to know how to set themselves up on scales that are accurate enough as well for the size of the bird.
Yes. So Leslie added a comment with, so she's the lady with the macaw on the fluoxetine. She said the medicine is sweetened like marshmallow. The plucking is under both wings. She'll speak to the vet again. We've had her for 9 years, and this is the first event with her, so I'm concerned. Yeah,
that is interesting. So I guess the other question to ask is, how long has she been on the fluoxetine for now? Because that's a drug that takes time to do its job as well.
Yeah, well, I'll give her a chance to just answer that. But I guess if you know, you've had her for 9 years, that doesn't, I don't know if she's 9 years old or if she's a rescue that you've had for 9 years and she might be 18 years old. But if this is the first time you've ever seen this behavior and she's 9 years old, that's one of those sudden presentations that we talked about where, yes, a health issue could be a contributing factor to that. If you've had a bird who's been pretty normal for at least 9 years and now suddenly you're seeing further destructive behavior, then certainly something to think about, because she's also past, at 9 years old, a blue and gold macaw is, you know, kind of, they're socially mature. They've been socially mature and sexually mature for a couple of years at this stage. And that would be sometimes when we see it behaviorally pop up, is when they hit that kind of sexual maturity stage. So at 9 or older than 9, she's kind of past that point. Let's see if she's... No, she hasn't commented again yet. I'll leave that there for a second.
So it depends on the time, and also if she's getting worse while she's on fluoxetine, maybe the dose can be changed, or maybe another medication can be added to the protocol as well. So feedback with your primary care vet is a really good idea, sooner rather than later. Certainly if things don't seem to be getting, or if anything gets worse in the meantime, sometimes the dose might be too high or maybe not high enough. And so feedback for your vet is really useful as you track through. Also, if that flavour doesn't suit your bird, and it might not, then the compounding pharmacy could change the flavour. There are a variety of nice flavours to trial. So Aztec likes strawberry flavour because that's the flavour we've got him on. So one flavour that's sweet is not the only option, I guess, is what I would like to say. So if you're struggling to get the bird to take it, then make sure you let your vet know that too, because they will try and help.
I did also want to add, I think it's really important when we are talking about issues that are primary behavioural, that medications aren't a magic wand. They are an adjunct and they're supposed to assist and get your bird in a better place. But realistically, you should also be working with a behaviour consultant to talk about all of those things, like your nutrition, your diet, your feeding schedule, how you're offering food, your environmental setup, and things that might need to be tweaked, changed, adjusted in those areas, as well as what training or behaviour work that you can be doing with them to overcome the issue. So that's, you know, an area it's really important that these medications are there to help, but there is still other work that needs to be done.
Panacea. I think what they are is a tool, as an important tool, but they're not going to, on their own, necessarily going to fix what you're seeing. So looking at a much more comprehensive and holistic program is really, really vital as well.
Yeah.
But definitely dialogue with your primary care vet, because it's very useful to have that feedback. And certainly even with the subtle story of changing the flavour of the medication, and over time, the dose might change. And also what you need to give to your vet is the actual correct body weight for your bird so they can adjust the dose accordingly too. But fluoxetine and the other SSRI medications, of which fluoxetine is one, certainly for mammals, take between 5 to 7 weeks to start to show their true value. So it does matter how long you've been on the medication. And if the animal's been on medication and not progressed, then you have to think about changing tack and switching to another medication, or changing the current dose to see if you can see a change, or adding another medication that works in a complementary way as well. So there's several choices about how. So medication is not just one drug and one dose for the one individual. There's lots of things we can do to manipulate what's happening and helping the animal better.
Yeah. And on the topic of getting help from a trainer or a behaviour consultant, is that they can also assist you with getting to a better place with, like, you get them onto a better tasting medication, but you may also need to do some work on that syringe and the association around that syringe now as well. And so that's something that a behaviour consultant can assist you with. So, and that's going to just reduce everybody's stress, because it's certainly not fun when you're trying to help your bird, but they're starting to become frightened or fearful or angry at you because you're having to catch them up or towel them to get medication down, and they're spitting half of it back out again, which, and with something like fluoxetine, it's really important that they're getting their regular doses. Otherwise, you're not going to see that therapeutic effect really, or it's going to take a lot longer to get there, because it needs to be consistent. So,
and don't be shy of asking for help is another thing. I guess it'd be sad to think that your vet thinks this little bird's been on medication continuously all the way through, and you've struggled and distressed on both sides of the equation. So that's what you're doing obviously now by asking questions tonight. But I would definitely ask for help. Don't be shy. It's much easier to help early than to try and patch things up later on. Everyone can talk to each other, by the way, as well. So I try to talk to my training colleagues, my clinical colleagues as well, to get better outcomes for our patients.
Yeah, absolutely. I think that's most of the pain questions. The other questions coming through are fairly general.
Nutrition.
How often should birds bathe or shower? Gosh, that's a tough one, because I don't think there's any set amount of times that birds should bathe or shower. Every bird's different. I mean, we're talking nearly 400 different species of parrots. So what your desert dwelling budgie requires is going to be very different to what your rainforest dwelling macaw requires.
It's about also giving them the opportunity to bathe rather than not providing an opportunity.
Choice.
Yeah. On how they want to get wet as well. Some birds will never throw themselves into a bath, but happy to have a shower. So very much a personal story, I think. But it's always about having it available and an opportunity there for the bird to explore those options. It's a bit like managing toddlers. It's sometimes exposing them several times before they will put a toe in the water, and how you present it. You don't throw them in the water. You can't do that. So you've got to present them with options and see what happens. But I do think preening is a very good functional behaviour. And if you are spraying the bird with water, it encourages them to start preening, which I think is really healthy for them.
Yes, yeah. It took my Eki 12 months to want to get in the shower, and that was she'd just sit on top of the shower. She'd have baths in other ways, and then one day she decided that she was going to have a shower, and then she demanded showers sometimes twice a day. Shower. So it's definitely providing, like Kat said, just lots of different opportunities and different ways and seeing what they like. And sometimes it's, noticing when they seem to want to bathe. So my little black-headed kaik only bathes in a water dish. That's fine. And the one thing that will probably almost always trigger that is vacuums. If I start vacuuming, she's probably going to start bathing. So little things like that.
It's all right. It's a possum, I think. Don't worry about it. Can't be anything else at this time of night, I don't think, really.
Is it bad to have food-orientated birds? No, definitely not. They try and steal food. I mean, that's annoying, and you can certainly do some training to overcome them trying to steal food, but food orientation is great. It makes training so much easier.
And every bird should be food motivated, because every bird should be wanting to eat so they stay alive as well. So I want to see that. But it's about giving them opportunities for a variety as well. And I guess identifying what they really love and utilising that during your training as a tool. All of those little things. But I what you have with a parrot most of the time, if you describe them as a toddler, it's probably helps people understand what they're dealing with in their home. And they're a smart toddler is also the other thing. Very smart.
Yes, flighted, smart toddler with a
primate-like ability. Yeah, they're amazing.
Yeah, excellent. So comments, couple other questions. Another question was, if I start on pellets, do I remove seed or do I mix it with their chop or what? Donna, this is a great question. It's a whole other topic. It really depends on the bird. Some birds won't see pellets as food straight off the bat, and sometimes it requires some playing around with creating and mixing and how you present it. I would, what I'll do is after we jump off the live, I'll drop some resources in the comments that we've got around that will probably help with that, because there is, like, we've got pellet conversion sheets and stuff that just outline some techniques you can try, because with some birds you offer pellets and they're like wonderful, and other birds they won't even look at it, or they just chuck it all on the floor because they don't understand that it's food yet,
or it's scary if it's foreign, or it's
scary. Cool. What I'm going to do is, I've got toddlers after 30 coffees. Sounds about right. One last question, and then I think we'll let Dr. Kat go. This one is, again, it's not really necessarily related to the topic, but it's asking what the temperature threshold is for birds during winter. What temperatures are okay for birds? I know they live in wild conditions, but can birds get sick if it's too cold?
If they can't get warm, I think that's a problem. I think they need to have the opportunity to get warm, even if they're housed outside. So certainly in zoo environments, we'll provide heat sources for animals to choose to come to, sit under or on top of, so that they can get warm. And then they can move away. So you don't want to have them in a position where they have no choices as well. So they need a choice about whether they choose to keep warmer. I don't know whether I think you don't want them sitting out in the freezing cold, but there are some birds, obviously like penguins, that require that they're in really cold environments. And working with jolly Arctic penguins is a pain in the backside, because you have to walk around in freezing environments all day, because they are not happy if it gets above a certain temperature, which is usually much colder than we would appreciate. So it's probably more critical for those birds like penguins, who are designed to live in very cold environments as well. I don't think our Australian parrots are quite tolerant of large swings in temperature, but you need to provide them with choices about a temperature. It's more of a temperature gradient option within their enclosure and within their environment. I don't know what your thoughts are, Lee.
Yeah, it's another one of those, it depends. But look, I have macaws that live in aviaries without any dramas, but I'm in Brisbane, so our kind of coldest winter.
You don't have cold, really.
Yeah, it's it might get down to 2 degrees very, like, once over winter. We don't have the kind of cold that you might see in Melbourne or something along those lines. It's going to depend on how often your bird spends time outdoors, if they've gotten used to it over time. Or are we just going from a bird who has never been outside to now they're outside and it's winter?
That would be a shock.
Going to depend on your aviary build. Is there adequate shelter to get away from, a cold breeze? If you've got your bird inside the house, it's never going to get cold enough inside a house in Australia for it to be a problem. So we're just too well insulated. You don't need to cover your bird up with 5 different blankets because it's 18 degrees in your house.
You might think that.
Yes, you might think that, but they're actually quite well insulated as well. If you've ever felt your bird's foot after they've untucked it from within their feathering on a cold winter's night, you'll find that their foot is incredibly warm, and it's because it's been tucked up in there, those down feathers. So it really depends on, it really comes down to what the temperature is getting down to. In Perth, where I know Andy is based, generally, if the bird is used to being outside and they have an adequately built aviary with proper shelter,
and good nutrition
as
well.
They're going to be fine, and good nutrition, they're going to be fine. If we're talking, places where it gets below 0, then that's a different story, and you might need to look at other options. Donna has said, I run ducted air heat at 22 since it's been colder, same in summer mostly. Donna, that is something to think about, because running ducted aircon and ducted heating can dry out your house, and birds need humidity. And so that's something you might need to think about for little Rosie. Yeah, you might need to look at getting some humidifiers or something along those lines. Because, that really dehumidifies your house a lot. At least you can just be like, whoop.
It's quite little.
Yeah.
Annoying me on that side, maybe you'll just reset you and you can start again. Work your way up.
He really wants your attention tonight, doesn't he?
I think so. Terrible. I don't know what happened. Got him dressed up so he's not, because it is chilly down here, and I thought maybe if you're unhappy you'll get cold, you'll start annoying me, but he's just annoying me because I'm talking to the computer at the wrong time of day, I think. Yeah, so it's outside normal. Yeah. So normally we won't be talking to the computer at this time, but I'm happy to talk to everybody tonight, definitely. So I guess with pain, remember, if there's and behavioural challenges, there's always, if there's a sudden change from what's normal for your bird, red flag, everybody, don't sit on it. Don't leave the bird for days. Birds don't have a lot in reserve. They're all quite little compared to us. So they can't go for many days if there's been some sort of change. So go early to your vet first. Then make sure they rule in or rule out clinical problems, and hopefully they won't dismiss the possibility of pain driving some of that change in their behaviour if they've ruled out other things that might cause that change. Because pain can genuinely be felt by birds. They don't scream. Well, they can scream, but they don't complain about pain like us. If they're uncomfortable or painful, animals in pain often do less rather than do more. So if they're usually active and busy and chatty, if they're uncomfortable, they'll often be quiet and more still than they would normally. So it's very important that you know your bird. And if you see a change, then consider going somewhere to make sure that it's not something that needs to be addressed quickly. Don't wait, I think, with a bird. It's a little bit like eye problems with dogs. Don't sit for a few days and wonder. Go straight to the vet. You only have 2 eyes. And little birds are tiny. Even if they're a big bird, a big macaw is only about 1 kilo, if that.
Yeah.
It's not big.
Yeah.
So they can't starve for days, and they can't not do for days. So don't wait. I guess people with big birds are more inclined to go early, but little birds get compromised really quickly. They're often presented really late, quite frankly, for clinical care. People have watched them for quite a while and seen that there's a change in their behaviour. The other thing too, behavioural changes can be caused by toxins, that if the bird is free flighted, they can be exposed to things that you don't know about because of their natural behaviours. So again, if there's any change, go early and get a clinical exam done. And I guess one of the clinics that we saw a lot of lead poisoning in some of the older houses, which had lead-based paints as well. So think that's not a painful condition, but it certainly we can address it, but we've got to catch them early so that they don't go on to develop clinical illness as well.
Yeah,
it's never too late. You're a good boy.
Yeah, absolutely. I agree. Yeah, early as possible. And don't be afraid to advocate. Like I said earlier, your bird best. And if you feel sure that there is something going on, don't be afraid to advocate. Don't be afraid to go, look,
could it be pain? Could it be? Yep. Get your vet thinking.
And ask for tests. Just, say, could it be pain? What tests are there that we can run to rule that out? Because they don't have that voice, and so it's certainly up to us to say, but what about? Don't be afraid to ask those questions with your veterinarians. Yes, they're professionals, but it's still worthwhile, and say to them, look, I know my bird really well, and these are the things that I am seeing that make me concerned that it's not just behavioural, but maybe it's physical.
And so I guess the other thing too is primary care vet, even if they don't have access to an avian specialist or behaviour specialist, they can look them up and can liaise with them. So we can all work collaboratively to help you too.
Yeah.
It's not outside the realms of possibility that we can all work together to help each other.
Yeah. Yep, absolutely. Cool. Well, we'll leave it there. Donna has said, I truly appreciate both of your time and advice. I've already learnt so much.
Thanks, Donna.
Andy said, you both have been awesome. Thank you for those that came along, joined us, asked questions, or just hung around and listened to us. Hopefully you can go away with, I guess, a little bit more understanding of why these sort of questions are important to ask, and why it's important to get to your vet as soon as possible when we're seeing behaviour changes, and why it's important before we even start addressing behaviour problems to address potential medical issues. And yeah.
Thanks everybody for listening. I hopefully that we've got you thinking about pain as part of what you're seeing sometimes. Don't dismiss it, because it is pathological. You don't have to. Animals feel pain, they feel emotions just like we do, and so they deserve to be having that pain treated correctly as well and comprehensively.
Yeah, absolutely. Awesome. All right, everybody. Well, thank you again for joining us. Have a fantastic evening. Thank you very much, Dr. Kat, for your time this afternoon. And that's it for now. We will hopefully be back with something else in the near future. All right. Thanks, everyone. Good night.
Bye, everyone.